for an update on the Lewis County Health System building project.
All right, thank you. So I've handed out our most recent Capital Improvement Oversight Committee monthly report, and this is the report that was presented to the committee on May 22nd, and then a week later the committee reports to the Board of Managers, and that's our structure of oversight by governance for this project. We have a standard agenda that we follow, and what I'll do is quickly take you through the report, and if you're stay engaged, we'll get to the part where the big pictures are. It's a little dry, but bear with me. Our committee, which is chaired by Don Musnicki, pays a lot of attention to both the budget items, well, the executive summary, the budget items, and the minutes of all the meetings that have occurred during the month make up this report. So it is very detailed. The executive summary is intended to be a high-level overview, and it's written by Mr. Mike Newfer from CNS, and they are the eyes and ears of the owners. And it's a good summary. He also identifies the critical issues. The critical issues identified last month have been there most of the project period, and you've had them with your own projects here at the county. Electrical switches. They have been essentially on back order since last August, and we have come up with a contingency plan so we can power the surgical pavilions because we're still waiting for them. As you know, the schedule changes frequently, so there's a tension there. And then Mike identifies a summary of major work activities by bid package, and I'll show you what that looks like in a couple of minutes. And then he also identifies what the upcoming work will be over the next couple of weeks. And then you will see several pages dedicated to the meeting minutes that occur. General attendance, all of the primes and the general contractor from the management team of the health system. Joining me are Jeff Hellinger, our CFO, and Rob Fargo, our Director of Facilities. There's always a reflection on safety, and we keep an inventory of, this is section of potential changes. And like all complex projects, this project has changes along the way. To refresh your memory, the project is the construction of a surgical pavilion that's connected to the hospital at 3 points. And we are constructing 3 operating rooms and 1 procedure room, a new county morgue, and materials management, so the storage, the receiving and storage of supplies for the health system. So it's a complex project, but it is all new construction. The other part of the project is the revitalization of all of the medical surgical rooms, the CCU, which is critical care unit, and taking the ORs out of the hospital proper. And it's a significant renovation when you're also continuing to provide care. And great opportunity to acknowledge the work of the nursing staff, environmental services, dietary, and all the ancillary services. Simply not easy to do. Patients have been incredibly understanding, as well as the families that we serve. So it's a complex project. Section G of the report reflects the various budgets that the committee will review. The first page of the budget is of the entire project, and then they're broken down by primes. Black Horse out of Watertown is the DC, and then the various primes. Like all projects, it moves along very nicely. It takes a lot of coordination to make sure all the disciplines are working together, but we're navigating supply chain challenges and sometimes the interesting personalities of the different groups that are working the project. There's an ebb and flow to these sorts of buildings. This is the third in my career, and it mirrors the first two. And we remain on target, both from a budget perspective, though I do think we'll start feeling some pressure there, and two, from completion. We are projecting that we will be doing surgical cases in the surgical pavilion in August. So then the follow-up question when I make that statement is what day? And that I do not give. So we need some flexibility on that point. For the revitalization of all the patient rooms on Med-Surg and CCU, we're anticipating February. Critical junctures involve the ability to move the ORs and the ability to get the Department of Health in on schedule for the inspection so that we can occupy. Not that no one's working hard at the department, but there are a lot of moving pieces and lots of layers you have to go through to make that happen. And now, I appreciate the opportunity to sit before you. There are lots of pictures, and each report includes all of these pictures. You know, people like Rob and Jeff and I have many opportunities to walk the site, and with these pictures you will get both the sense of how much has been done and the complexity of the project. And the initial several pages are within the surgical pavilion. Everything is at a higher level or more intense level when you're dealing with operating rooms and all of the requirements that have to be met in order to have a functioning surgical service. And the complexity becomes apparent as you go through the pages. And then after that, we get into the outside, which is the third part of the project, the exterior work. And I'm talking about the construction site. We are creating a new driveway from the number 3 road to State Route 26. We are creating additional parking. We're applying all of the appropriate environmental techniques when we do this sort of thing. We've had to move lots of rock in order to facilitate this project. We worked with the DOT for the drainage and runoff, and I think that has gone very well. We have clearly modernized the facility. We've modernized the presentation of the larger campus, and I've been very impressed with all of the teams working on the outside. And then after the committee gets through this, we move to the architect report. So we go from our project manager to the architect report. Our architectural engineering group is VCA, and Rick Tack specifically, who meets with the committee. And he addresses critical issues, coordination of owner equipment, job changes, then the whole process of submittal reviews. Each report is unique to itself, and Rick and his team provides an update from their perspective. It is much smaller than CNS's report, primarily because the engineering group at this point is adjusting to changes as the project continues, and just supporting the construction of the building. Towards the end of that report, there are some nice aerial photos of the campus, and you get a sense for the driveway. We're avoiding calling the connection between the number 3 road and the Route 26 a road. We really want to create the mindset it is a driveway to enter the campus, because it is not intended to be a cutoff between the two, and it is not intended to be driven, faster than 15 or 20 miles an hour. I think we can train not only our teams at the health system, but our community to understand that this is a driveway to access services The pictures give you a good sense of what that driveway will look like, the retaining wall that's in place. We are a week and a half away from laying pavement, and so it'll really take some shape here. So the takeaway, I think everyone has worked hard since the last April when we had the kickoff to the project. It is an incredibly complex project. We've met our budget and deadlines to date. I think we're going to feel a little more stress in those areas in the months to come, which is not unusual. And the supply chain continues to provide an operational challenge each and every week, but we're navigating that as you all have been with your project. So I remain optimistic, and as you know, last week I was able to share we have a new general surgeon returning back to Lewis County, and when the Board of Managers and the Board of Legislators endorsed this project, the hope was that we would be more effective in recruiting. And so one down and others to go. And I think if you can practice in a modern facility, then you're likely to retain, and that's what we're trying to do. That was pretty quick. Not the 20 minutes allocated, but if you have any general questions, I'd be happy to take them.
Along the lines of recruitment, speaking with Marcy Teal recently, she said that there's definitely a decrease in travel nurses being required right now, and that recruitment efforts at the hospital in general are very strong right now. So I commend everyone over there. Marcy said there's a lot of just culture work going on, so it sounds like a very exciting place to work right now.
Yeah, I think there has been good work by many people. Probably the area that remains the most challenging on the recruitment front and staff openings is in long-term care, and that's not unique to our system. It is across the North Country, across the state, and across the country. I think it will really force a dialogue at some point in the future. Is this one of these temporary blips of time, and then eventually we will have more young people coming in who want to fill these roles, or are we going to have to right-size our service lines around long-term care and think about delivering something to the senior members of our community in a way that's different than we're doing it now? So I think this will force us to begin thinking about those things.
Right, absolutely. Does anyone else have any questions? Oh, Bill, go ahead.
Thank you. How are you coming with maternity?
Yeah, well, we are moving slowly but surely. We have a candidate, and we're working through that process now. Yeah, that's probably the most I'm able to share at this point.
That's fine.
So we're moving forward, and for the first time since September of 2021, there's some encouraging signs.
Would that be a result of those creative billboards that you did?
No, yeah, it was creative, but not as effective as we had hoped. We had 193 hits to our landing page, but that did not generate a single interview. So from that regard, it wasn't effective. We're not done with the billboard. However, we had a family practice interview this morning. We had one last week, and there are some key locations in New York that we're going to introduce Lewis County to: Albany, Syracuse, and Rochester, encouraging family practice physicians to consider us.
I thought it was a great idea. Try it. Why not try it?
Yeah. And I think part of it is somehow creating awareness that we aren't as far as sometimes people want to think we are. And we heard it a little bit ago in the discussion around legal services, and sometimes it's a mindset. We're stone's throw away from Canada, and the way I like to think about it, we're only 5 hours from Boston. And Joan, I'd be remiss in not
Just
mentioning
because
that.
they swept this weekend, it's not a reason to
And what occurred
become a
last
fan,
and the
right?
weekend before.
Right?
Well, you know, Boston's 5 hours, New York City's 5 hours, Montreal is 4 hours. I mean, we can get to many places from here, and I think we need to do a better job of expressing that.
Yeah.
Yeah.
Absolutely. New studies out there suggest that more and more people, money isn't the biggest driving factor in, making the decisions about where to work. It's a lot about that work-life balance, or, what they, want out of life, not just the money. So I think that we're very, fortunate here to offer those things.
And in fact, before coming here this afternoon, I reviewed the new digital images for the family practice billboards, and there's a real focus on work-life balance. However, I think I'm becoming a little bit of a cynic on the money matters. This is what I think I'm finding as I engage in these recruitment discussions.
Okay,
All
very
right,
good.
thank you.
Questions? Thanks, Jerry.